I think our biggest problem right now is dealing with what the government tells us we can and can't do with patients, meaning allowing them to do
Hmm.
their HPI, allowing them to do a lot of their history for us, and and sharing that. And again, there's pros and cons to that, and we could argue about it, but I think giving them that ability, patients are getting more used to that. When they go to the airport, they don't interact with people very often now. You've checked in online before you ever got to the airport. How do we reproduce that function for patients so that their time spent in office is
Hmm.
a minimum?
As a physician, if you're able to bring in a cardiologist while the patient's there to see you versus having to do another visit, even if it's a virtual visit, right? Because you're looking at some type of cardiac conditions. I think we need to look at how do we do more in terms of providing more advanced care to the patients, not
Yep.
necessarily directly in front of us, right? Physically in front of us, but also from a tele perspective. And then really helping to improve the patient literacy, right? Understanding and being more involved in their healthcare.
So
Yeah, I've seen this interesting movement around experience wrappers. During COVID and the last couple of years, we have purchased all kinds of different solutions that require their own particular app, right? So all of us, like, Prisma is an Epic shop, one instance of Epic. We have MyChart. Utilization rates, we have a lot of activation, but utilization rates around 8 to 10%. Then we have remote patient monitoring. It has its own app, so you can connect your Bluetooth connected devices. We had a Gozio application for wayfinding, etc. Right, and then you had a different one for appointments. So what I've seen now is that these experience wrapper companies that can take all those applications, put it into one window pane of an app, white label to that health system. So you as a patient, Adam, would log in that SSO into your MyChart. You would then not only get the data that's coming in and out of MyChart, you would actually see, hey, I got your appointments coming up, and boom, you got a push notification. Then as you start to travel, it will then give you wayfindings to the office, and even through the bill is fintech is really taking off. So how do we improve the ability for a patient to pay a bill?
Yep.
But more importantly, how do we make that bill simpler so they understand what that bill is for, what they're responsible for, what the insurance is going to pay? And if we can use then again social determinant data, claims data, what is the propensity to pay? So if Ray got a bill for $1,000 based on his background, he can pay the total bill. He gets $1,000 bill.
Yep.
But if I were to get it, it would say, Nick, it's $100 over 10 payments, no interest, and automatically getting paid. I've also seen, in talking to another major health system a couple weeks ago, they implemented the ability to pay through Apple Pay and Google Play through MyChart, and they're able to get a significant amount of bad debt paid for by patients. So patients just wanted an easy way to actually pay their bill. So just being able to implement simple technologies that we use every day to buy groceries and things of that nature, check into hotels, making that consumer experience frictionless and easy. So I think fintech, outbound patient engagement tools, and experience wrapper are I think, really hot technology.